Ladies, gentlemen, and everything in between, hello, welcome to the channel. If you guys know me, then you know that I am currently in nursing school, which is why I haven't been able to upload as much as I usually do, but it's also the reason I'm interested in this video. Today we're going to be checking out the NHS and learning all about basically England's healthcare system. You guys get free healthcare. It's not technically free because it does come from the taxes, but I say it's free because when you walk in, you don't have to pay anything. Whereas if I were to go to a hospital in America, I would be leaving with a student loan bill, essentially. So I'm just going to learn more about the NHS, really the ins and outs of it, and just the whole English healthcare system because it interests me, and I hope it interests you too. So, subscribe if you're new here, like the video, let me know what other content you'll want by DMing it to me over on Instagram, and let's get into the NHS. Shout out to all healthcare workers. If we have any on the channel, comment down below so I can recognize you. We appreciate you. Yeah. What is the audio? Does the video not have any?
How does the NHS in England work? What organisations make it up? And how is it changing over time? Since the NHS is largely funded by our taxes, let's start with the government. They decide how much money the NHS receives and do top-level priority setting.
Okay.
The Secretary of State for Health is in charge of the Department of Health, which is actually quite slimmed down compared to what it used to be.
Oh.
And it passes most of its money on to a range of other organisations. The lion's share goes to an organisation called NHs England. It was created in 2013 as part of sweeping reforms aimed at improving services by increasing competition, cutting red tape, and keeping the government out of the day-to-day running of the NHS.
Okay, so they don't want it run by the government. They want it to be kind of privatized. Private healthcare, though, is what got America in the situation it's in. So let me know how you feel about this, the Lions Act, or whatever she said.
But this is all actually quite far from what's really happening, as we'll see. NHs England is responsible for overseeing the commissioning, the planning and buying of NHS services. In practice, it also sets quite a lot of NHS strategy and behaves like an NHS headquarters.
Cool.
NHs England commissions some services itself, but passes most of its money onto 200 or so clinical commissioning groups across England, also known as CCGs, which identify local health needs and then plan and buy care for people in their area.
Okay, so the CCG is really the core of healthcare for England. Hold on, I'm just verifying that it's working because I've had some technical difficulties. But yeah, the CCGs are the ones that kind of mitigate the different needs of the community and actually know what the people actually like, what they need. So I feel like there's a lot of passing around of the funds where it could just go straight from the government to the CCGs and just divide it by population or by need, or you know, if one community needs more than another, then you can divide it up fairly, I guess. What's the need for all the other organizations divvying out the money? Why not just be government straight to the CCGs, the clinical commissioning groups?
People like you and me. CCGs buy services from organisations of different shapes and sizes, from NHS trusts that run hospitals and community services to GPs and others that provide NHS care, including organisations run by charities in the private sector.
It's cool to see that y'all have like your own little cubby for mental health too, because until recently in America we didn't really start recognizing the need for mental health and considering it like you know, you have appendicitis, you have colonoscopies, you have all these other physical health things that you need, but also your mental health is just as important, I feel like, as like your internal health. You know what I'm trying to say? I don't know. But you have local authorities, hospital providers, community services, general practitioners, ambulance providers, charities, private sector. Cool, different little organizations.
Jostling for position alongside NHs England is NHS Improvement. It oversees NHS trusts, and right now its focus is very much on managing the money. So, for example, it tries to ensure that trusts keep a lid on costs, operate efficiently, and, you know, improve. Also in the mix is the Care Quality Commission, which inspects the quality of care provided.
So many organisations.
There are also a whole load of other bodies with their own remits and acronyms. This is quite a crowded landscape, and the upshot is that these different organisations can at times issue seemingly contradictory messages. There are also unclear boundaries about exactly which organisation is responsible for what, prompting questions about who's really in charge.
Yeah. again, there's so many different hands divvying into the pot and trying to control different things. I'm sure they all have their own purpose, but couldn't you have maybe one organization and the different departments in that organization that control all of this? Like it says, we look at quality, make sure you have enough staff, don't overspend on staff, but we look at quality too. Like, it is really kind of like cross-hairing, and I feel like, again, it would just be better to have less organizations and maybe just one or two that control all of it, right? Let me know how you feel.
But the NHS never stays the same for long, and the way these organisations work together is changing. The most recent changes started in 2014, when Nhs England published a vision for the future of healthcare called the NHS 5-Year Forward View. This called for more of a focus on preventing people getting ill in the first place and giving patients more control of their own care.
Nice. Patient-centered
It also
care.
set out a range of so-called new models of care that aim to get services working together to provide joined-up care for patients.
Yeah.
There's not been much progress on the prevention bit, but lots of energy has been put behind the new models.
I like this model.
These set out to do things like provide care traditionally delivered in hospitals, like chemotherapy, in people's homes, and get people to work differently. For instance, dementia specialists carrying out clinics and GP surgeries. This new way of working is particularly designed to help meet the needs of increasing numbers of people who need support to help manage a range of long-term health conditions, particularly older people. 50 areas across England, known as Vanguard sites, have been trialling these different ways of delivering more joined-up care over the past couple of years.
Successful?
This is all part of a broader shift towards organisations working together more closely to meet patients' physical and mental health needs.
Nice.
And away from an NHS marketplace. The NHS has invented or adopted a whole array of acronyms to describe this new and evolving approach. Firstly, there are STPs, or Sustainability and Transformation Partnerships, which aren't things or organisations in themselves, but, as the name suggests, more a way of working together in partnership.
So interpersonal, interprofessional cooperation, basically. So instead of having the different organizations control the stuff, you just have the different healthcare workers work together for that one patient. So it's all centered around the one patient. That's kind of how we have our healthcare system. Like, all the different practitioners, nurses, lawyers, nurse managers, case managers all work together. There's not like, oh, you need to call this governing organization or body. No, you can just call up straight up the person, the worker.
These were created when NHS organisations were asked to come together with local authorities, charities and others to agree how to improve health and modernise services in their patch. There are 44 STPs in England, all focused on progressing the ideas set out in the 5-Year Forward View. But they haven't exactly had an easy birth, with accusations of plans being cooked up behind closed doors and driven by financial cuts. Some STP areas are on track to develop into another 3-letter acronym, ACSs, or Accountable Care Systems. These take inspiration from parts of the US, where organisations work together under a set budget to improve health and coordinate services for people who live in a particular area. In part, these changes are all about managing the limited resources available to the NHS, but they're also about working together with services outside the NHS, like social care and public health, that have a really important impact on our health.
See, I thought the NHS was all things, anything for healthcare. Whether it's just dental care, whether it's just, what do you call, not dermatitis, dermatologists, you know, whether it be an actual surgery, all different things for health, cosmetic surgery. I thought it all fell under the NHS, but apparently I guess not. So the NHS is just hospital care, like med-surg, ICU, operating room kind of thing. Again, I thought the NHS was like top tier and they work with the government directly. But no, the healthcare system is way more complicated than I'm finding. Anyway.
Requires much closer working with local authorities. Some areas are taking this regional-based approach even further. So, for example, in Greater Manchester, devolution is giving local NHS and council leaders more control over how health and care services should work there. And across England, we're also starting to see CCGs merging, hospitals working together in chains, and GPs forming large groups of practices.
Cool.
So where does this leave us, and what next? Well, there's a lot of change going on, and it throws up loads of unanswered questions. Not least, what does this all mean for patients like you and me? Well, in some ways, nothing much changes. You'll still see a GP when you're ill, and there'll still be hospital care. But if these changes are successful, you may well get more support and treatment at home rather than having to go to hospital, more help to stay healthy, and you might also get to see a GP quicker. You might see more controversial changes too. For example, you may need to travel further from home to access better hospital services.
Or you could just provide better hospital services locally. Why make it on the patient to go the distance? Why not just make every hospital universal? Universal healthcare. If you need a specialist, okay, can you not hire another specialist locally at this hospital? But then you're going to bring up costs because you have to pay the specialist. But cost shouldn't be a factor in determining my care. You know, that's the whole point of having the NHS and like affordable healthcare, right? I don't know. I just wish economics and money wasn't the driving force behind healthcare, because the whole point of healthcare is to care for others, and it's supposed to be like an empathetic thing, you know?
All of these changes take time and won't be easy, especially when the NHS budget is failing to keep up with the growing cost of caring for an aging
So raise the
population
budget
with increasingly complex healthcare needs, and when NHS staff are feeling stretched and under pressure. 70 years after its creation, the NHS continues to be highly valued by the public, with many seeing it as a national treasure.
Okay, so why aren't they treated like one then? Why are the workers stretched thin? Is there just not enough healthcare workers in England, or can y'all not do travel nursing like we do here? Or travel healthcare workers, I guess. Because the NHS is always talked about like it's a grand thing, but I don't know, are they taking like the back seat in importance when it comes to the government?
Looking at the bigger picture, change in the NHS is nothing new, and this is just a snapshot of where we are now. The story will inevitably continue.
Oh, that's crazy. Again, I thought the NHS was just like a surface level kind of thing, like everyone gets healthcare, it's free, and just come when you need it, and you'll be cared for. But no, there's a lot going on behind the scenes that I'm finding, and it's way more complicated than I thought originally. So if I got anything wrong, or if there's something that needs clarification that she didn't explain well, comment it down below, or DM it to me over on Instagram, because I may not see your comment. But yeah, if y'all want me to do more NHS or just hospital or healthcare reactions, let me know, and I'll see you in the next one. Bye!